If you have pain at the low back, hips, groin, or buttocks, your sacroiliac joints should be evaluated. They cause pain in 25% of the population, but still are often overlooked. Let's review the sacroiliac joint and then discuss diagnosis and treatment of sacroiliac joint dysfunction. The sacroiliac joint is the largest joint in the body, but it moves very little. It is a critical shock absorber between your spine and legs. A stable sacroiliac joint is not painful. However, when ligaments around the sacroiliac joint become lax, the joint becomes unstable and pain occurs. Sacroiliac joint laxity results from traumas such as car accidents, lifting and twisting injuries, falls, etc. It also occurs due to infection, pregnancies, arthritis, or other cumulative injuries. Additional stresses on the sacroiliac joint comes from previous lumbar fusion, obesity, lumbar spinal stenosis, pregnancy, scoliosis, gait changes, or leg length discrepancy. If you have back pain, what kind of activity brings it on or worsens it? If it's caused by swinging your leg to get out of a car, rolling into and out of bed, or prolonged sitting, it may be caused by your sacroiliac joint. If it's worsened with repetitive bending, with loading, a dishwasher, or pulling weeds, it may be your sacroiliac joint. There are specific physical exam tests performed to determine if your pain is related to the sacroiliac joint. Because sacroiliac joint pain is related to instability of the joint, an X-ray or MRI of the joint may not be helpful. Once sacroiliac joint dysfunction is diagnosed, sacroiliac joint strengthening is recommended with specific sacroiliac joint exercises and using a sacroiliac joint belt to help stabilize the joint. If physical therapy cannot be done because of pain or is not helping, a sacroiliac joint injection is recommended to help decrease the pain to better engage in those exercises. Sacroiliac joint injections may use a local anesthetic, also known as lidocaine, with or without steroid, aka cortisone. The duration and timing of your pain relief with the injection of the particular type can further clarify the underlying cause of your sacroiliac joint pain and point toward subsequent courses of action. For example, if you have good relief of pain for several months when a steroid is used, it is possible to repeat that injection for likely arthritic changes to the joint. If you have good pain relief for only a couple days, then a radiofrequency ablation of the sacroiliac joint or sacroiliac joint fusion may need to be considered. Using the minimally invasive techniques available today, a sacroiliac joint fusion can be performed at a surgery center on an outpatient basis with a surgical time of about 30 minutes and done via an incision less than an inch long. The titanium screws that are placed across the sacroiliac joint strongly stabilize the joint while the body forms bone around and through the screws. Patients are often walking within hours of surgery and going back to work or vacationing in a few days. In the end, there is no age limit for sacroiliac joint dysfunction. Being active or getting older is not a reason to have pain. Conservative care with physical therapy, supportive bracing, and injections is a good starting point. If those are not helping reduce your pain or improve your function and quality of life, a sacroiliac joint fusion is a minimally invasive option that will not hold you back from living life. If you have back pain, make an appointment with a pain specialist today. If you have any questions or comments, please feel free to leave them in the section below. Thank you.